Hello everyone, this is Dr TSR. Today I am here to share the guidelines regarding NASG removal. NASG is non-pneumatic anti-shock garment. So when there is PPH in the peripheral center, that is at primary health center, when you want to refer a case, so what we put is NASG. So NASG can only be put if there is any suspected PPH and you want to refer a case to tertiary center. So in this video, I will tell about the objectives of how to remove NASG. NASG contains 6 pairs and we will start putting it from below, that is from the ankle to the up to the level of abdomen. Right? So this NASG can only be removed if the blood loss is less than 50 ml per hour for 2 hours and her BP and pulse remain stable for 2 hours and she is conscious. So this is the guideline for removing NASG, that is again given here, that bleeding has decreased to less than 50 ml per hour and pulse is stable, that is pulse less than 100 beats per minute, and her systolic blood pressure is more than 100 mmHg or more than 90 mmHg and woman is conscious and awake. Okay, if this conditions suitable for the next 2 hours, then only we can remove NASG. As I already told, NASG contains 6 pairs, that is pair 1 at the level of ankles, pair 2 at the level of calf, pair 3 at the level of thigh, pair 4 to the pelvis, pair 5 and 6 at the level of abdomen. Okay, so you have to tell us segment pair for 1, 2, 3 and just segment 4, segment 5, segment 6. Okay, so these are the segments and pair in NASG. So you should start putting it from the ankles and you also should remove from the ankle itself. So here comes the waiting period of 15 minutes. When you want to remove the NASG, you have to wait for at least 15 minutes before removing each segment. So let us go through the important steps to be taken before removing NASG. See, when you want to remove the NASG, always wear the gloves before removing it because the NASG can be soiled also. So you won't be knowing the status, HIV status or HbCG status of the woman. So it is preferable to wear the gloves, then measure her blood pressure and pulse rate before opening the first segment pair. Okay, so the initial BP and pulse has to be measured and you would be catheterized the patient, so you will be knowing the urine output also. So you should start opening the segment pair 1 first, and if she is a short heighty, then we can remove the segment pair 2 also. Okay, after opening the segment pair 1, wait for 15 minutes. After 15 minutes, again recheck her blood pressure and pulse rate. This is what is rule of 20 in NASG. That is, her pulse should not increase by 20 beats per minute and her systolic blood pressure should not be decreased by more than 20 mmHg. So, if the pulse and blood pressure remain stable, then only I will go for opening the next segment pair. Okay. So it is same after segment pair 1, segment pair 2, then segment pair 3, segment pair 4 and finally the segment pair 5. Remember, wait at least for 15 minutes. Waiting period is 15 minutes. Then you recheck her blood pressure, then you recheck her pulse rate and make sure there is no difference in heart rate by 20 and blood pressure by 20 mmHg. Then only we can proceed for the removal of next segment. Okay. While removing the segment, if you found there is increase in the pulse rate and decrease in the blood pressure, so then what to do? Then nothing, just start closing the segment very fast. See, after removing every segment, if the mother vitus is stable, then you will put the used NASG garment into the biohazard waste container. Okay, so the rule of 20 is, I have already explained rule of 20. So if there is any abnormality from the rule of 20, then it suspect there is vaginal bleeding. So you have to start quickly closing all the segments and consider the need for more IV fluids and more blood transfusion, and we should assume that woman is still actively bleeding, and we have to determine the source and cause of the bleeding and do further treatment. Okay. So when you want to practice it, you need a NASG garment and a model and a volunteer and a gloves, BP apparatus, stethoscope and a timer and a trainer and a trainee. So do practice NASG garment putting and removing in your tertiary care center also, so that when a case comes, you will not be hesitated, or you will not be in a gadbad to put how to put a NASG. So remember one thing, when a patient is referred from the primary health center with the NASG, it is not you will remove the NASG and give that NASG kit of the PHC center to them and you will use your NASG. So when the patient referred with NASG, you will receive the patient with the NASG of that PHC and you will give the NASG what is there in your tertiary center to their PHC. Okay, so these are the checklist. Always prefer learning with a checklist so that you will not even miss a single step. So the checklist for NASG is, you have to check the BP and pulse before opening the first segment pair. So you have opened the first segment pair and you will wait for the 15 minutes, take the BP, take the pulse, and if BP and pulse remain stable, then you will open the segment pair 2. And wait for 15 minutes, take the pulse and blood pressure. If BP and pulse remain stable, then open the segment pair 3, that is at the level of thighs. Okay, again wait for 15 minutes, take the BP, take the pulse. If BP and pulse remain stable, open the segment 4. Segment 4 is at the level of pelvis. Then again wait for 15 minutes, take BP and pulse. If it remains stable, open the segment pair segment 5 and 6, that is at the level of abdomen. So if at any point during the removal, if there is change by 20, then immediately close all NASG. Remember, starting from the ankles, starting at the ankles. So after all this, if you are removing completely NASG, place the used NASG in a biohazard container. So this is a checklist for the removal of NASG. This PDF is available in the internet. So please download the PDF and read about NASG removal and steps, and even paste this NASG checklist in your labor room so that you will not forget, and always practice this checklist as a program of Lakshya so that you will remember what are the steps, how to remove, from how to put the NASG to how to remove the NASG, how long I should wait, 15 minutes, what is the rule I have to follow, rule of 20. So this is a knowledge assessment they have given when you should start removal, that is if her bleeding is less than 50 ml per hour for 2 hours, if her BP and pulse remain stable for next 2 hours, and if she should be conscious and aware. If she tells this is uncomfortable, please remove, you are not supposed to remove, that is not the thing. Second, you will start opening it by abdominal segments? No, you have to start opening it by the ankle segment. Third point, so while removing each segment, how long I should wait? You have to wait for 15 minutes. Fourth point, which rule you have to follow in NASG? That is rule of 20. That is, you have to start removing it from the segment 1, wait for 15 minutes. Pulse should not increase by 20, BP should not reduce by 20. If that is so, you have to quickly close all NASG segments starting from the ankles. Okay, need for additional IV fluids and blood transfusion has to be thought, and you should suspect the woman is still actively bleeding and consider what is the cause and evaluate and do laparotomy if needed. And when completely removed, it has to be placed in a biohazard container. Thank you. This is Dr. TSR. Please like, share and subscribe for more videos.